Most men with diabetes and erectile dysfunction have had their blood sugar checked dozens of times, but almost none have had the 5 blood tests that actually explain why it's happening. These tests are not rare, they are not expensive, and they are available at almost any standard lab. But when they are not checked, the real cause can stay hidden. In the next few minutes, we will break down all 5, what each test measures, why it matters, and what your results may be telling you. We will start with the one test that almost every man with diabetes has already done, but may not fully understand. 1. HbA1c. Your doctor may call it A1c. This simple blood test shows your average blood sugar over the last 8 to 12 weeks. Not this morning, not one meal, your long-term sugar control. Why does that matter for erections? Because high blood sugar quietly damages the inner lining of blood vessels, the endothelium. That lining helps release nitric oxide. Nitric oxide is the signal that tells blood vessels to relax and widen during an erection. When damage builds, nitric oxide drops. Blood vessels respond less. Blood flow declines. Erections become weaker, slower, or less reliable. And penile arteries are small, very small, so they often show damage before larger arteries do, sometimes before the heart, sometimes before the kidneys. One study found that 68.6% of diabetic men with an HbA1c of 7% or higher had erectile dysfunction. More than half had moderate to severe ED. Doctors often aim for an A1c below 7%, depending on the person. So if your A1c is rising, it may not just be a diabetes number. It may be an early warning sign for declining sexual health. 2. Testosterone. The second blood test often gets missed, and it may explain why blood sugar control alone has not fixed your erections. Because most of the attention stays focused on blood sugar, total testosterone, free testosterone. 2 measurements, both important. Total testosterone is the full amount circulating in your bloodstream. Free testosterone is the small active portion not bound to proteins, the portion your body can actually use. Only a small percentage is truly free, usually around 2 to 3%. Think of total testosterone as money in your bank account. Free testosterone is the cash in your wallet. You can only spend what is in your wallet. That means a man can show normal total testosterone on paper, yet still have low, usable testosterone. So why is this common in men with type 2 diabetes? Because there is a signaling chain from the brain to the testes, the HPT axis, hypothalamus, pituitary, testes. Chronically high blood sugar can disrupt that chain. Signals weaken, testosterone production declines. When testosterone falls, men often notice lower sex drive, reduced morning erections, lower energy, slower recovery from workouts, weaker or less reliable erections. This is more common than many realize. In a study of over 1,000 men with type 2 diabetes, conducted at the National Center for Diabetes, Endocrinology, and Genetics in Amman, Jordan, 36.5% had low total testosterone. And of those men, more than 80% had symptoms, including low sex drive, fatigue, and weak erections. That is why experienced urologists often check both total and free testosterone, not just one. Many labs consider total testosterone below roughly 300 nanograms per deciliter low, though ranges vary. Symptoms matter. Sometimes repeat testing matters too. Timing matters as well. Testosterone naturally peaks in the morning, so testing is usually most accurate early in the day, commonly between 8 and 11 a.m. If you are dealing with diabetes-related ED and this test has not been checked, it may be worth discussing with your doctor Because sometimes the issue is not only blood sugar, sometimes it is hormones too. So we have looked at blood sugar and we have looked at hormones. Now let's move to the third system that directly controls erections, your blood vessels. Before we go further, a quick note. This is the third episode in our ED and diabetes series. All videos are created by our expert urologists and sexual health specialists. The full playlist link is available in the description. ErectoGuide is a digital healthcare platform dedicated to helping men overcome erectile dysfunction through research-backed protocols. Our team has developed a unique 6-factor ED framework that addresses every root cause of erectile dysfunction. With privacy and confidentiality as a priority, we created the ErectoGuide Video Guide, a structured 4-week action plan. Step-by-step video modules, weekly checklists. You can follow it privately at home at your own pace. No clinic visits, no prescriptions required. You can try the demo version for free. No login, no credit card required. Details are in the description. Now, let's move to the third test. 3. Lipid panel. The third test is one you have likely had before, but no one told you it could predict erection problems. The lipid panel. It measures 4 things: total cholesterol, LDL, HDL, triglycerides. Here is why it matters. High LDL and high triglycerides can drive atherosclerosis, fatty plaque building up inside artery walls. Over time, those plaques narrow the arteries, blood flow drops. Now, here is what makes this critical for erections. The arteries that supply the penis are only 1 to 2 millimeters wide. The coronary arteries supplying the heart are larger, around 3 to 4 millimeters. Smaller arteries often show reduced flow sooner. That means circulation problems may appear in the bedroom before they appear anywhere else. This is why erectile dysfunction often shows up 2 to 5 years before a man's first cardiac event. In one study of 382 men with type 2 diabetes, 57% of those with erectile dysfunction had elevated triglycerides, higher than men without ED. So when you look at your lipid panel, you are not just checking heart health. You are checking the vascular system that determines whether blood can reach and fill erectile tissue. If your lipid numbers are out of range, your erections may be the earliest warning sign of vascular disease. 4. Prolactin. The fourth test is one many people have never heard of: prolactin. It's a hormone produced by a small gland at the base of your brain, the pituitary gland. Most people associate prolactin with breastfeeding, but men produce it too. And for men, balance matters. When it rises above normal levels, it can disrupt erections through 2 separate pathways. First, it can suppress the signals from your brain that tell the testes to produce testosterone. Second, it may interfere with nitric oxide, the key signal that allows blood vessels to relax and fill during an erection. That means even if your testosterone looks normal, elevated prolactin can still interfere with erectile function. Some medications commonly prescribed alongside diabetes, certain antidepressants, antipsychotics, and stomach medications, are known to raise prolactin levels. If ED medications are not working as expected, prolactin may be worth checking. 5. TSH, thyroid stimulating hormone. The fifth test looks at your thyroid. Your thyroid controls your body's metabolic engine, energy production, hormone regulation, and cardiovascular function. TSH is the signal your brain sends telling the thyroid how hard to work. When the thyroid slows down, a condition called hypothyroidism, it can reduce testosterone production, nitric oxide activity, and blood vessel function. 3 of the core pathways involved in erections. But here is what often gets missed. There is a milder form called subclinical hypothyroidism. The thyroid is underperforming, but standard blood work may still appear normal. In a study conducted at West China Hospital of Sichuan University, Subclinical hypothyroidism was found in nearly 30% of men presenting with erectile dysfunction, compared to just over 5% in the general male population. Nearly 1 in 3 ED patients. The normal TSH range is roughly 0.27 to 4.2. If it has not been checked, it may be worth raising with your doctor. So here is the bottom line. Erectile dysfunction in diabetes is not just about blood sugar. It is about blood flow, hormones, and underlying biology. These 5 blood tests help you identify the missing piece. Because your body is giving you signals, you just need to understand them. If you want to go deeper, the Erecto Guide video program, designed by urologists, can guide you step by step. Check the description to try the free demo. Full playlist and resources are in the description.